Dr. Sandra for this presentation. I think it's going to be of a lot of value to each and every one of us. Managing stress, owning a business, having leadership roles in the different corporations, is tough. But just the fact that you made it here today, and for those that are joining us online as well, we thank you, and we hope that you find this seminar as of value that our healthcare committee put together. Special thanks to the committee, Dr. Julie Basan, and the entire healthcare committee for putting this together. This week we do celebrate Small Business Week, and incorporating a health wellness webinar, I think, is as important as any of the other events that we have scheduled for the rest of the week. So thank you again for being here on behalf of the Laredo Chamber of Commerce Board of Directors. Thank you.
So thank you so much. Thank you, Rossi. Thank you to the board of the Laredo Chamber, and of course the entire team, the staff who is the backbone to everything that we do. We'll now get to the main reason why we're here, and I'd like to invite Mr. Elmo Lopez, CEO of Gateway Community Health Center, to introduce our speaker. Mr. Lopez.
Thank you, Dr. Basan. Thank you, Rossi. Thank you to all the members of the chamber. It's always a pleasure to host our partners in the community here at Gateway. So you've given me some time at a microphone, and that's very dangerous because I'm going to first talk about Gateway. There's a misconception, and I do want to introduce Lupita Canales, a member of our Gateway board. Lupita, thank you for being here. Before I introduce Dr. Contreras, I do want to say a few words about Gateway and what we do here. We are what's called a federally qualified health center. There's 1,500 of us nationwide with 16,000 locations. And we served last year about 36 million patients. Most are patients in need in each of the communities that we serve, and we're all over the place. There's 2 of us in San Antonio, there's several of us in the Rio Grande Valley, 4 of us in Dallas, and definitely in rural communities across Texas and across the nation. We serve the population that is not served by anybody else. That's the population that is most in need, those that have no access to medical or dental insurance. We take those patients here. But I want to make it clear, we also take patients with insurance. And if you want excellent quality care, safe care, come to Gateway. We have access. That's what we're about. The government established us 50 years ago to create access, especially for those that were most in need. And now Congress, because we are federally funded, Congress let us, back in the 90s, start taking care of patients with insurance. Teachers, Border Patrol, city employees, those businesses that have insurance for their employees, like the banks and things like that. We take all patients with or without insurance. So if your business does not carry health insurance for your employees, send them here. We do medical care, just think of us as a large doctor's office or dental office. We do primary medical care, behavioral health care, which Dr. Sandra Contreras is the lead, and we do primary dental care. We have pharmacies where you get discounted medications if you're a patient. We have radiology, mammography, ultrasound, all these things under one roof. So please send us your employees. They need to be cared for. Everybody needs a doctor's visit, a dental visit, and most importantly, especially right now, and I was a chairman of the Small Business Committee back in 1979, 1980, 1981. I'm a past chairman of the Chamber of Commerce. I'm very proud to be here with you today. What we've learned in our journey with the Behavioral Health Department that we kind of been ramping up for the last few years is that every one of us needs to be talked to. Or better said, we need someone to talk to. Okay? Doesn't mean that you're have a behavioral health issue, but you may have depression, you may have anxiety, especially today with all the stuff going on. Just turn on the TV, read the Laredo Morning Times. It's not happy out there. So come to Gateway, because Dr. Sandra Contreras and her vast team will be able to talk to you and help you through some of the issues that you may have in your business, in your personal life, etc. Dr. Sandra Contreras is a licensed professional counselor supervisor. She has a doctorate in professional counseling from Texas A&M International University. And TAMIU has a great psychology department. They put out some great people. We've been hiring all their graduates here. She also has a Bachelor of Arts in Psychology from TAMIU. She's been doing professional counseling for 15 years. She joined us here as the department head of our behavioral health department back in July of 2021, right as COVID was kind of in our face. And she hasn't stopped. She's been growing the department. She's a great influencer for all our folks here. And she helps us manage our patients on the behavioral health side. Please help me welcome Dr. Sandra Contreras. Plus, she was born and raised in Mexico City. Doctora. Oh, and her husband's a coach at LBJ, and she has 2 sons. And the dog?
7, no.
No dogs. Okay.
Oh, no dogs, no, unfortunately. Make sure I adjust this. Okay. Good morning. Thank you so much for that wonderful introduction, Mr. Lopez. I am very grateful to be here today. And I'm very grateful to be talking about mental health and stress because, if you're not aware, May is Mental Health Awareness Month. So it's definitely a perfect topic for us to be talking about today. And of course, as part of the behavioral health team, this is something that I live and breathe every day. So I'm happy to be here. So today we're going to be talking about mental health, wellness, and how to manage stress in our work environments. So I do have a little overview. Let me see. Sometimes I can be technologically challenged, so I apologize for any mishaps. But we're good so far. Okay. So just a little overview for today, just so we can kind of get an idea of what it is that we're going to be talking about. So I always like to share what the landscape looks when it comes to mental health in our country. So I'm going to be talking a little bit about statistics and what mental health, mental wellness looks like in the workplace. So was a very interesting study or survey that was done by Mental Health America. They do a project that they've been doing for about 10 years now, where they ask employees, they issue a survey and they ask employees what their mental health, overall health looks like when it comes to their workplace environment. So I'm going to be talking a little bit about that. We're going to be talking about what stress looks like and how it compares to burnout and what the difference is and what we can do to kind of spot what are those things that we ourselves might be dealing with, or how we can notice those things in our coworkers or in our employees. Then we're going to talk about a little bit about how we can manage all of this in the workplace. I'm going to give you some tips of what we can do and how you can manage your stress. And then also, because I don't believe that it should just be all on the employee, I think it's important that if there are any employers here too, that we look at what are some practices or policies or procedures that we have in place at our workplaces and how we can better provide healthier workplace environment for our teams. So this is what our day is going to look like. Okay, so Mind the Workplace 2024 report is a report that is done by an organization called Mental Health America. So they survey the United States and they look at what are some mental health trends and what are some things that, are going on in our country when it comes to mental health. So this is a survey that is done about every year. So these are the most recent findings from 2024. And it shows how business leaders can integrate mental health into workplace infrastructure and culture, from building trust through transparent communication and cultivating support. So what it does for this past survey that they did, they collected responses from 3,915 employees across 21 industries in the US, and they asked them questions to where they were able to share their experiences of trust, appreciation, psychological safety, which I will get to and I will explain what that is, support in work, and its impact on the person's overall well-being. So these are some of the findings that they found, and if you go on their website, you can Google it and you will find the full report. It's about 40 pages long, but these were the most striking findings that I thought were important to share with you guys today. So one of the ones that stood out was most employees reported that work stress impacts their sleep and their relationships. But this did vary in their overall workplace health, right? So that very much depends on other factors contributing to workplace health. 3 and 4 employees agreed that work stress affects their sleep, their relationship, and their health. There were some trends that they noticed when it came to different populations of individuals who are in the workforce. So for example, Generation Z employees, which are our youngest employees in the workforce now, and millennials report poorer overall work health scores than other generations compared to the boomer generation and the silent generation. But it's important to consider nuances here, okay? Because I know what some people might be thinking, but we need to consider other factors that might be contributing to individuals' health, right? So it's not just, sure, it's work stress, but there might be other contributing factors. And also we want to account for the fact that, the silent generation only accounts for about 1% of our population and things like that, right? So just putting that out there. Employees with higher rates of psychological safety feel more confident in advocating for others' needs in the workplace and their own needs as well. So often employees who feel confident expressing their opinions with their team, 87% strongly agree that they feel confident advocating for their and others' needs. So I'll get into psychological safety in a little bit, but that's essentially what it is. It's this belief where in the workplace I feel confident and safe enough to share any concerns or any issues with my employers without fear of retaliation or things like that, right? So that's essentially what psychological safety is. And then another finding was that Generation Z employees feel less psychologically safe in the workplace than other generations. 63% reported not feeling confident expressing their opinions, and 60% don't feel that they can be themselves at work. So I know that this can cause like a lot of discussion, so I would just encourage you guys to ask yourselves why these might be some issues, right? Like why some generations feel less psychologically safe, feel less unhealthy at work, and how does that compare to other generations, and what we can do to help all our employees and all of the people that we work with feel safe at work. And I know that we're going to leave questions and discussions towards the end. So what is work-related stress? So I want us to think about stress as a continuum, right? So one end of the continuum, we have stress, and then at the far end, we have burnout, right? So work-related stress refers to any physical, emotional, or mental strain that comes from performing one's job. So there can be a wide range of factors that contribute to work-related stress. So it could be a demanding job role. It could be long hours. It could be job insecurity, right? Which I know that is something that can be a factor recently. Negative relationships with coworkers, with peers, with supervisors. Having a sense of low autonomy over one's work can cause stress as well. Work-family conflict, or poor work-life balance. So those are just some things that might contribute to stress, right? So how can we tell either within ourselves or maybe with our peers or with our coworkers what it might look like, or what are some signs that I'm feeling stressed or there's work-related stress? So we can see having negative changes in mood, including irritability. Was that me? I apologize. And I'm a millennial myself, so I like to communicate in memes. So hence my little picture there. So having negative changes in mood, including irritability, anger, and sadness, continually being absent from work or noticing like, oh, like I really can't go to work today, or I'm really drained or exhausted, right? Or trying to leave early from work, getting to work late, things like that. Demonstrating decrease in the quality of work. So increased number or frequency of mistakes. You notice that you're more distracted, lack of concentration, things like that. Expressing feelings of feeling stressed, becoming less cooperative or maybe even hostile with our coworkers or employees, and appearing tense, uptight, anxious, restless, depressed, all of those things. So those might be some signs, right, that we might be experiencing work-related stress. Now, what are some of the effects or the consequences? So we might notice some physical consequences, right? So increased, there has been incidences that show that the more work-related stress, we might be more at risk to have an increased risk of heart disease, headaches, digestive problems, sleep disturbances, aches and pains. So a lot of physical health conditions that can come along with that. And psychological health conditions as well. So irritability, concentration difficulty, anxiety, depression, substance abuse, right? Who likes to get home from work and enjoy a little glass of wine, and then all of a sudden it turns into 2 glasses of wine, or scotch, or something like that, right? Or all of it, right? So once we start noticing that maybe that 1 glass of wine isn't enough, and then maybe I have to have 2 or 3, that's when maybe, that can be a good indicator as like, okay, maybe I'm starting to misuse or abuse substances to try to deal with the stress, right? When we start noticing that we're withdrawing or isolating and we just, don't want to engage in our relationships. So like I said, stress is a continuum. So how do we know if it's stress or if it's burnout? So to the point where we feel that this stress can no longer be managed and it's impacting our ability to function, that's when we can say that maybe we are getting towards burnout, right? So remember, it's a continuum. So at one end, we're stressed, and at another end, we're burned out. So we can like lie along anywhere in the continuum, or sometimes even go back and forth. So burnout is chronic work-related stress that has not been managed. So again, wide range of factors, very similar to stress, and what burnout looks like. So again, excessive workloads, low levels of support, reduced psychological safety, unsafe work environments, right? So if we're getting to the point where we're talking about things like sexual harassment in the workplace, lack of equity and inclusion, things like that can certainly make work-related stress exacerbate to burnout. So those are the things that we want to consider. So when we think about burnout, we want to think about 3 characteristics of what it looks like. So feelings of energy depletion or emotional exhaustion. So even it doesn't matter like how much rest you might get, if you are getting your 8 hours of sleep, or if you're doing this or that to manage, but you're still not able to recuperate, or it's still feeling very stressful, that could be an indicator that maybe we've gotten to this point of burnout. Increased mental distance from one's work, and negative or cynical feelings about your own work, right? So not caring about the work that you do, right? Not caring that maybe you're starting to make mistakes and it's like, whatever. That can be another sign that you probably gotten to that point. Reduced sense of self-efficacy at work. So this sense of like imposter syndrome, right? Where I don't think I'm good enough, or I don't think I'm good at this job, right? Where before you felt pretty confident. So what is it that got you to this point? And again, we have negative long-term consequences of burnout. So it doesn't just affect the employee, but it affects the company and the employer as well, right? So in an organizational sense, we see more absenteeism, which we know that that can, has a negative cost to our employers as well. Job dissatisfaction. And there's also something called presenteeism, where the employee might be showing up for work, but they continue to work even while being unwell. And we know that that can cause some risks as well, especially if we're in the healthcare industry, right? It's not on me, so are we good now? Yeah, okay. Okay, can you guys hear me okay? Okay, good. So they continue to come to work even though they're unwell, and we know that that can cause some risks, right? Again, and the psychological and the physical consequences that we noted earlier can just have continuous effects, not just on the employee, ourselves as employees, but also as the organization as a whole. So some numbers for you guys. I'm all about numbers. 57% show of people who have experienced burnout increased risk of workplace absence greater than 2 weeks. 180% increased risk of developing depressive disorders, and 40% have an increased risk of hypertension and other physical health conditions. So what do we do? What do we do if we're starting to notice work-related stress or burnout? So I know that this wheel is very small, but this is what we call in the mental health field a self-care wheel. And you can easily Google it, you'll find it, and then you can also find, if you put into Google self-care wheel worksheet, it'll give you a worksheet so you can work on your own self-care plan. So one of the things that we really want to emphasize when it comes to dealing with work-related stress is prioritizing our self-care. So I always like to say self-care is not always fun. A lot of the times we think of self-care of going to get our nails done, going on vacation, well, that is very fun, and we do need those breaks. But there are levels of self-care that have to be non-negotiables, okay? And that mainly has to do with our own physical and psychological self-care. So if you look at this wheel, there's different versions or areas of self-care, and then there's different recommendations as to what you can do to fulfill those needs. So physical self-care is probably one of the most important ones. So it can be as simple as going to your regular checkups, your annual checkups, your blood work, taking care of yourself physically through your nutrition, exercise, right? Exercise is not always fun, but we know that we have to do it, right? And a lot of people get caught up in like the complexity of self-care, like, oh, well, I have to be very rigid on my diet, or I have to do this intense exercise. That's not what it has to look like. It could look like whatever it looks like for you. So if exercise for you is going out for a walk every day for an hour, that's great. You're getting physical health, physical activity. If it's 80% of your diet, you're eating whole nutritious foods, but you have a cheat meal every once in a while, perfect, right? It doesn't have to be perfect, but it has to be something that works for you to help balance that stress. So we also have psychological self-care. Therapy is a great option, and we're here to help at Gateway. But if that's not an option for you, seeking out support groups, seeking out other people, even maybe either within your own company where you can engage in and build up those relationships and things like that. Journaling, doing meditation, mindfulness, things like that can also be great ways of self-care. We also have things like spiritual self-care, right? So for a lot of people, especially in our community, they're very involved in their church. That could be an excellent way. Or if you're not religious, you know, just going outside and meditating or whatever it is that you connect with spiritually or what spirituality means to you, that could be also a great way of taking care of that need. Personal self-care, professional self-care, which we'll talk a little bit more about as well. So again, in order to be like well-rounded in your self-care needs, you don't have to hit all the targets, right? Like, you know, you can create your own plan that works for you. And what works for you doesn't necessarily mean that it's gonna work for another person, right? So whatever you feel fulfills those needs, it is fine. So I really do encourage y'all to look into the self-care wheel, and you can create your own self-care plan for yourself. Another thing that's very important, and it's a huge therapy speak, if you're on therapy TikTok or anything like that, you've seen this around, but it's setting boundaries. So setting boundaries at work is very important, and so what do boundaries look like? There's a big misconception about what boundaries are. A lot of people believe that boundaries are, you know, how we or how we manage other people's behaviors, but that's not necessarily true. There's a difference between rules and boundaries. Rules dictate how other people behave, right? So for example, at my house, I have a rule. Everyone's in bed, well, not everyone, my kids, right? Kids are in bed by 8 o'clock. That's the rule, okay? So they have to be in bed. But if they're not ready to sleep, they can just chill there in bed. Like they can play with their stuffed animals, but that's the rule, okay? A boundary dictates your own behavior. So what could this look like in the workplace? So there are different types of boundaries that we can start setting when it comes to managing workplace stress. So one of them can be what we call a time boundary. So for example, you know, if your job is a typical 9-to-5 job, my time boundary is I don't answer emails after 5 o'clock, right? That could be your boundary. Now, that doesn't dictate other people's behavior. Other people can still email you after 5, but it's up to you if you decide whether or not to respond to those emails or to phone calls or whatever they are, right? So again, your boundary doesn't dictate other people's behavior, but it dictates your own. And so you also have the luxury of setting those boundaries, right? So if you want to answer your emails after 5 o'clock, if 8 o'clock is better for you to catch up on emails, that's on you. So those boundaries look different for everybody. Or another time boundary can be like, I clock out at 5, I'm leaving at 5, things like that. So we have time boundaries, we have energy boundaries. So energy boundaries are boundaries that we set to not extend more energy than what is needed, especially in the workplace. So for example, I am a therapist, and as much as Mr. Lopez wouldn't like me to say this, I'm not the office therapist. So, so you know that you'll be in therapy with me if you receive an informed consent, and if I'm in private practice, you'll get an invoice from me, right? I'm not in private practice, but just as an example. So, so what kind of energy boundary am I talking about? So since I'm a therapist, but I'm not the office therapist, it's important for me to set boundaries in terms of like people coming to me for psychological or emotional help, right? So I'm not here to do that kind of work. I'm here to offer the therapy for my clients or the support for my supervisees, which it is something that I do. And I bring that up because that has happened to me in the past at previous work experiences. I've had people, kind of take up some of my time coming into my office and trying to talk about their family problems and things like that. And I had to learn really quickly that I had to set those boundaries. Like, I'm sorry for what you're going through, but that's not my role with you right now, right? So think about what those roles are and how you're expending more energy and things that maybe could be outside of what your job role, right? And so it's important to set those boundaries as well. And then lastly, a communication boundary. So there's this quote in the therapy world that goes, clear is kind. So clear, honest communication is kind, right? So a communication boundary could look like something like, if a supervisor asks you to complete a task, right? So we communicate, we can respond by saying, okay, can you give me a deadline by when you need this task completed, right? So I want us to think about boundaries as not a way of being defiant. It's a way of being consistent and being clear, so both roles could be completed accurately, right? And so we feel that we can have that psychological safety to express what our needs are in the workplace. So boundaries dictate your own behavior, rules dictate other people's behavior. So that could be helpful in managing some of the stress, right? And then of course, so prioritizing social relationships within and outside our workplace. So this is also kind of like a form of self-care, right? So we want to disconnect. When you have your time off, really disconnect and engage with your social relationships, your friends. Take the time off that you need. So those are ways in which we can help buffer some of the stresses that may come along when it comes to work-related stress. So how, as employers, we can create a healthy work environment. So it shouldn't be just all up to the employee to manage their stress, right? Like, yes, we're hoping that our team is taking care of themselves and they're doing what they need to do to take care of their own physical, psychological, and emotional health. But there are also things that we can do to create that safety and that health in our agencies or corporations or businesses, right? So I know that this might look different for the different corporations that are out there. I know it all depends on budgeting. I know it all depends on manpower, and I know it all depends on the resources that you have available to you and what you're able to offer your teams. And I recognize all that. So I'm not saying that you have to do all these things, but these are some of the things that maybe you can consider and see what you can do in order to offer a safer and healthier work environment for your teams. So going back to that Mind the Workplace report that was done by Mental Health America, they also asked employees to share or to talk about what are some of the practices or benefits that their places of employment have that has helped them feel safer and healthier at work. So employees reported that things like employee assistance programs, EAPs, have been very helpful in terms of feeling that they have the resources available to them to seek out some of these things like the physical self-care, psychological self-care, things like that. Generous paid time off was something also that was reported as that had a good potential on the impact of the employee's well-being, and a family benefits package. I know that it depends on the resources that we're able to provide, but things like, childcare or, health plans, things like that employees felt that was something that they really valued from their employers, and that they felt that really contributed to their overall well-being. So we want to create systemic surveys, reviews of employee wellness and job satisfaction, doing annual, job employee satisfaction surveys, checking in with our employees and see, what is working, what is not working, and using that information to be able to create policies, programs, or things for our employees so they feel healthier and safer at work. We want to try to keep track of workloads, check in on employees, and encourage taking advantage of time off. I know Mr. Lopez always tells us, take your time off, take your PTO, that's what it's for, right? So that's something that we need to also remind our employees that's available to them. So we might want to look at our organization's practices and consider employee benefits that will ensure resources needed to manage workload and job stress. So again, that goes back to all these programs, right, that we might want to look at and see, like, what can I offer my employees? Okay, so if I can't offer this benefit, what are other versions, or what are some of the things that we can do as a team to help these employees feel, safer or healthier here at work? So some other things that were also mentioned in this report that employees found really contributed to their overall well-being were things like merit-based pay salary increases, professional growth opportunities, mentorship programs, people management training, right? So like learning, okay, I'm in this management position, but I don't know how to manage people. Like, what are some training opportunities that you can offer me so I can learn how to manage my team? Things like that, right? So one of the things also that we want to look at is we want to make sure that we enhance the overall psychological safety of our teams and our employees. So what is psychological safety? So I mentioned it earlier. Psychological safety is the belief that a workplace is safe for interpersonal risk-taking, allowing employees to speak up, admit mistakes, and propose ideas without the fear of punishment or humiliation, right? So think about, you know, your work experiences or your previous work experiences. How psychologically safe did it feel to talk to your employer? And did you have that fear of, like, if I speak up, if I say anything, if there's gonna be any retaliation, if there's gonna be any punishment or humiliation, right? So that is what psychological safety is. And so, so we wanna look at ways in which we can improve that within our teams. So members, again, with this study, so employees who felt psychologically safe were able to admit and discuss their mistakes with their employers. They could openly address any problems that they noticed. They were more willing to seek help and feedback. And they trusted that they are a valued member of their team, right? So that is what psychological safety is, and that is one of the things that we can also offer our teams to help them feel safer and healthier at work. And that is all I have for you guys today, so now I'm gonna open it up for questions. Thank you. There's a question right here.
Hang on, let me get you on the. Sorry. So that way we can get you.
Yeah. Okay. So thank you so much for the presentation. That is literally who I am. I'm a servant to my community, so it's hard for me to say no. So for me, I have a question on what you would advise. I am the kind of person that feels stress physically, like literally, like I don't know if it's my kidney or something. Every time I get stressed, it hurts. So I'm like, I'm stressed. What would be, or my neck as well? It's immediate. I physically feel my stress. I could handle the stress, it's not a big deal. But when I start physically feeling it, what would be your advice for me to come down from that pain as fast as possible? Because it hurts a lot. I take ibuprofen, but I know that I didn't know it was stress until I looked it up, and I came to find out that everybody experiences stress differently, and for me it's physical. I knew that there was nothing wrong with my organ, but as soon as it throbs, I'm like, something is stressing me out. What is it? Let me solve it immediately, because I know that's what it is. I know that I'm not physically, that there's nothing wrong with my organ. It's just how my body tells me, you're stressed out, you need to pull out. But what is the fastest way for me to come down from it? Because I'm struggling with it really bad this past month has been really scary, so.
So I will preface this with saying I'm not a medical provider, and I don't know all your history, right? But if I were your therapist, or if I, were assessing you in a mental health way, I would, first of all, I think it's important that we become self-aware of our symptoms, right? And you're right, stress looks different for everybody, and it presents differently for everyone. So it's important to really look inward and start, paying attention to those things, and even sometimes if it's really foggy as to, okay, why am I feeling this, and what is it that I'm feeling, keeping a journal almost, right, as to track your symptoms and to track, your stressful days or less stressful days, things like that. So I don't have a straightforward answer for you, and I apologize, but my response would be to, for you to seek out medical care and to see where, because we also again, as my therapy speak is coming up, we also want to rule out any medical health conditions that might be there, right? So I always encourage my patients, I always encourage my patients to visit their doctors if there's any physical ailments, and then we can go the other route, right? But I would also encourage you to take a look at what your self-care already looks like and where it might be lacking, so that wheel could be very helpful in looking at, like, okay, well, am I engaging in physical exercise that benefits me? Can I work on other things, right, that I'm not already working on right now, and see what could help you in that sense. Right,
For anybody that's on the chat, just a reminder to put your questions for Dr. Contreras in the chat. We have another one in-house.
Thank you. Super good presentation. It went by so fast. When Jennifer spoke, it was like listening to me when I was her age, which is kind of funny. I really want you to elaborate on that.
Sure.
The under 40, that are like her, very active in the community and at work, they think that they can handle it, but when they get to our age, it's a different thing, because your body does take a toll. So if you can elaborate on that, so they can understand that maybe they can handle it now, but in 20, 30 years, their bodies can't handle it, and what you're doing to yourself then or now, later in the future, is going to affect you.
Yeah. So I think we also need to understand that there's a biological effect when it comes to stress, right? When we are under stress, our fight or flight response gets activated. So what that is our nervous system, right? And so our fight or flight response is our sympathetic and parasympathetic nervous system at play. So if we think about it, usually we think about it in an evolutionary perspective, right? So when we are presented with an actual physical threat, we always give this example of like a bear in the forest, right? So your nervous system gets activated. Your body starts releasing all these stress response chemicals in our body, right? And so adrenaline and all those things. And so all of those things could also exacerbate our physical health, especially if that stress is chronic. So if we're constantly presented with that bear, if our stress response is always being activated, it's going to cause these negative health conditions, right? And then we want to think of our health as an overall health, not just our mental health, but our physical health, but our overall health, right? So it's always like the chicken or the egg. Like, is my physical health causing my depression, or is my depression causing, right? And so we need to look at all of that as a whole. And so if we spend all this time not trying to manage that stress, certainly over the years, it can exacerbate and create more long-term health problems as we become older. So yes, thank you for that.
I have two questions, but I'm going to ask the more important one, I think. Okay. How do you relate the mental awareness to the person that's causing all the mental awareness? I mean, all the mental problems to everybody, right? Like
how do we call out the toxic people in our lives?
Exactly. How do you engage a team where the culprit is the person causing the majority of the problem? How can you do it when it's a person that's needed? It's obviously moves work forward. Right. How can you?
You ghost them. So that's a very good question, and I think also a complicated one, right? So it's hard, especially those of us who are in a administrative position or managerial position, or even vice versa, right? It's hard to have those tough conversations. It is. And so I think it's important to try to come from a place of understanding and maybe even curiosity. We want to try to minimize defensiveness. And so, when we try to have a tough conversation, a lot of the times we need to be aware of our own emotions. So if we're feeling angry, frustrated, that's really going to impair our conversation and how we approach a person. So we really need to consider our approach, right? And so when we want to have a conversation with someone about their behaviors, how they're maybe it's creating like a toxic work environment, I think we need to consider space, we need to consider time, and also coming from a place of curiosity. So maybe it could look like something like, hey, I've noticed that recently this and this has been happening, and it's been creating these kind of reactions in our team, and I wanted to raise awareness, right? So that's a good question. I think we can spend a lot of time talking about that, but again, usually if coming from a place of curiosity and understanding, because that person might not even realize that that's what they're doing, and it's creating all these problems, right? So, yeah, I hope that answered your question.
A quick reminder again to everybody that's on the chat, if you have a question, please place it in the chat.
Hello, I have a question.
Yes.
So first of all, I wish this was longer. I'm very big on mental health awareness. I got my bachelor's in psychology, so this is like my favorite thing. So one big advice that I usually give to my friends or family is that if you have a significant other and you get into an argument or a disagreement, I don't like to say argument because it's just dependent on how you approach the situation, I do three things, right? You either ask each other, do you want to talk about it, or do you want a distraction, or do you want some space, right? So the rule is you choose one, right? But I guess my question to you would be, what if that doesn't work? So you would usually work for me. It usually works because, I mean, it's dependent on who you choose to be your significant other and you know them, right?
Yeah.
But if that doesn't work out, what would be the next thing you would do?
Like when you're trying to have a difficult conversation, or in what context?
Yes, because I know, so I know communication is a big thing, at least for me. Because if you don't have communication, like more than 50% of marriages, they get a divorce because of miscommunication. In regards to that, I guess, would be my question.
Again, I think that warrants a much longer, deeper response. You guys are asking good questions. I think it really depends on the situation, what the dynamics of the relationship are, and the context of what the problem is, right? I think those are very good options. I will add, though, to one of those options is because, when we go to someone, like, it depends on what it is that we need from them, right? So sometimes we just need to vent. Sometimes we just need to, talk. But other times we need a solution, too. So I would add, do you want a solution, right? So how can I help you fix it, or how can we fix it together? That could be another option as well, because sometimes I just want to vent and talk to my husband and say this and this happened and I'm so frustrated and angry, and he wants to jump right on and try to fix the problem, and I'm like, no, I don't want a solution right now, right? So that could be an option. But again, I think like there can be so many other things that might be contributing to a problem. So it really just depends on the situation. More questions?
Thank you. I think these are all great questions. And as a community, I mean, we're here as a partner, right? Gateway, Laredo Chamber, celebrating Small Business Week, and mental health wellness is a very, very important topic. As you may know, in the past couple of weeks, there's been several fatalities regarding, around mental, health. I myself experienced, I think it was last week, I was driving over the overpass of Loop 20. It was 7:30 a.m. and I see a car parked, right? First thing that came to mind was that, right? But I was like, oh no, somebody's car just stopped working at the very top of the bridge, right, on Loop 20 and 35. And then shortly after, I got, to work and to the office, and I opened up my Facebook, and sure enough, when I was passing by the overpass, the body was already, in the ground. So I think all of us, if we don't manage our stress, it can lead to anxiety, to depression, and then perhaps that. So as a community, what resources are out there for anybody that is either seeking help or has somebody in their family that we want to help, right?
Sure.
What resources are out there, and how as partners, and small business owners and leaders, help our team see if we are able to identify that person, that individual is going through, some issues.
Right. Thank you for that question. I think that's always important because we can always talk about, what it looks like and, we can always talk about the information, but we need to follow through with action, right? So, so a not so shameless plug, but Gateway. We do have our behavioral health department, and we really don't have many limitations when it comes to seeing patients. We see patients as young as 5 years old and as old as 99 years old. We see patients who are insured and uninsured. We gratefully have a program right now where we are not charging for our behavioral health services, so we are able to service a big portion of our community. And what I mean when we don't have many limitations is that we're able to see a wide range of conditions when it comes to mental health concerns, right? So definitely depression and anxiety are the biggest ones that we see, but we also help, for example, with teenagers manage their ADHD symptoms, social anxiety symptoms. We offer grief counseling, we offer couples therapy, family therapy. We offer behavioral modification services for parents who have difficult behaviors with their little ones. So we really can see most of it. Some of the things that we might have some limitations are if there are significant mental health concerns where the patient does require additional care when it comes to psychiatric care. But we will coordinate with our local mental health authority to make sure that those patients are receiving the psychiatric care that they need, and if they're stable enough, we can certainly continue with services as well. You mentioned the suicide attempt that you noticed. So we also coordinate with our local mental health authority when it comes to our patients who do show a high suicidality or suicidal ideation. We still will work with them, but we also, we coordinate care either within our own clinics, right, when it comes to their medical care or even dental care, but also with our outside resources. So we also have Border Region who does offer that crisis intervention and that psychiatric care. We will coordinate with other agencies, and there's other agencies out there as well, such as SCAN, Pillar, who also have a robust other services that they offer, right? So there is a lot out there. I do recognize too that there are limitations, especially when it comes to psychiatric care. That's a need that we really do have, and we ourselves here at Gateway have also seen, right? We don't have many psychiatrists, so that's something that hopefully as a community, I know that there's being a lot of work done within the community to help improve that.
Just, I know we're running out of time, and I also wish this was an hour longer. Doctora, thank you so much. Just to comment on our needs locally, as I've been in healthcare since 1997. Some of you weren't even born yet, I don't think. But we need two things here that will get us to the top. We need a pediatric hospital, because right now, God forbid, none of your kids or grandkids should have any problems, but everybody is being flown out either to San Antonio or to Driscoll and Corpus Christi. There's no care. It's not the hospital's fault, but they just simply don't make any money on pediatric care. That's fine. But inpatient, I'm talking about, we have the largest pediatric practice here. We have 10,000 kids that come to our practice, both for behavioral health, dental, and medical care. We need a pediatric hospital, or a pediatric unit within a hospital, number one. Number two, we need an inpatient behavioral health hospital. Again, within the hospital that exists, and Doctors Hospital, their parent company, Universal Health Services, is the largest provider of inpatient psychiatric care, behavioral health care in the country. They have 300 units all over the country. We would need to pressure them, ask them to bring in an inpatient behavioral health hospital, because that brings psychiatrists. You cannot have a hospital like that without psychiatrists. And that's how they practice, both inpatient and outpatient. Again, Dr. Contreras did a great job. This is a group counseling, by the way. Oh, one more question. We will be collecting PayPal or credit cards on the way out, $75 per person. Yes, just kidding. What? Oh, really? Okay. I'll turn it over to.
On the chat, we have questions?
Victoria Gutierrez asks, to receive counseling service at Gateway, do they have to be referred by PCP?
No, they don't. They just have to register in our clinic, and it's very simple to do. So they can always just give us a call, and our patient navigators will help them get that established. With or without insurance.
Then the next question is for Claudia Ruelas. This question is on my personal side, how we can express things have changed to older generation. Example, older generation say at times, back in my days, we weren't like your generation, complaining or similar, to avoid being dismissed due to being younger or other mentally.
Tough question, but a good question.
That's a big one and a tough question too. I appreciate that, but I think it's, again, trying to come from a place of empathy. I know that there's always these generation battles, right? Like our boomer generation versus the millennials, and now the millennials versus the Gen X or the Gen Z, right? So I think it's important to not look at it so much as a generation thing, but also, just as a circumstantial thing, right? We don't know what the other person is going through. We don't know what kind of stressors they have in their life. I see this all the time, especially in therapy as well, where older family members might not understand why younger youth are experiencing depression and anxiety when they haven't lived as long. And so it's important to educate those people, what are some of the things that contribute to depression and anxiety and things like that, right? And so just because you haven't lived as long doesn't mean that you're not prone or more at risk to develop these mental health conditions.
Yes, hello. I'm a former school counselor, still a counselor at heart. Yay. And this topic really, really hits home. Right now, I'm going through a personal issue with a relative that I love very much. But I also feel that, I see many business owners here and employers, people that lead teams now. I lead a big team of people that service our community. And I just wanted to tell you that I really appreciate all of this that you're doing, and that when you touched on the topic psychological safety, I feel that as employers, leaders, business owners, we have to own up to our responsibility in being more compassionate, more empathetic to the people that we are leading, because sometimes we might come across as hostile. They're in a hostile environment, or you don't understand them. You're not as compassionate, and you don't know what's happening. You don't know what's happening behind. In their personal life. And sometimes we inadvertently, I don't think it's intentional, but, we tend to come across rude or, demanding or inconsiderate or incompassionate. And sometimes that you don't know that something is already brewing up in that person's life, and then you make it worse by everybody's fighting their own battles. Mm-hmm. So I think we have to be more compassionate, have that empathy there, provide that safety environment where people can feel appreciated, loved, cared for, and that they're not alone, that you're there. I lead a team of hundreds of people, not just in Laredo, all over Texas. And when I come across a team member that is not showing up to meetings anymore, it's not responding to my text messages, is feeling that I pick up the phone and say, hey, Maria Elena, what's going on? I see you're distancing away. I see that you're not responding. I see you not showing up. Are you okay? I'm here to help you. I mean, be more compassionate than like, hey, why are you not producing? Hey, how come you didn't meet the deadline? Hey, how come you're not, promoting to that next level? Let's remind ourselves to be compassionate and treat our employees or the people that we're leading, with more empathy, more compassion. That's all I have to say. Thank you.
Thank you so much.
Thank you so much. Let's give Dr. Contreras another round of applause, please.
Thank you. Thank you all for having me.
Thank you, thank you. I think you have really empowered us with the tools that we need to be better
Yes.
individuals.
Perfect
at
for
work,
Mental
at
Health
family.
Awareness Month.
Thank you so much, Dr. Contreras.
Thank
and
you.
Thank you, Mr. Lopez, for hosting us for this amazing event. And I have a feeling that we're going to be coming back to touch on this subject. I want to thank you on behalf of the entire Chamber of Commerce Board of Trustees, the Health Services Committee, for joining us today. I hope that it was something that you can use daily. And if you have any questions later on, I know that you can email the Chamber about, and we'll forward them to Dr. Contreras through the Health Services Committee. So this will conclude our event, but we want to tell you the important and great news that the Health Services Committee has gathered some door prizes. So all of you that attended will be entered into a raffle, and you will probably have a chance to win door prizes. We will send you an email and notify you to stop by the Laredo Chamber. Thank you to all our sponsors for giving us those door prizes. I really want to say thank you to Gateway Community Health Center, Dr. Contreras, the membership of the Laredo Chamber, and every one of you for keeping our community growing and prospering. And like I said before, if you can't think of any resource to call or get a hold of, 988, 24 hours a day, 7 days a week. You can call, you can text mental health professionals, and they'll guide you or refer you to the right agency that can help you. In the meantime, take care of yourself, be kind to each other, and most importantly to you. Have a blessed day. Thank you.